Compartment Syndrome, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Compartment Syndrome, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of compartment syndrome. Chapter 1. 1. What are compartments? Compartments are groups of nerves, muscles, and blood vessels. 2. What is compartment syndrome? Compartment syndrome happens due to pressure around the compartment that results to a limit in blood flow. 3. Compartment syndrome is also called exertional compartment syndrome. 4. Can compartment syndrome be life-threatening? Yes, compartment syndrome can be life-threatening. 5. Can compartment syndrome be acute? Yes, compartment syndrome can be acute. 6. Can compartment syndrome be chronic? Yes, compartment syndrome can be chronic. 7. Compartment syndrome occurs mostly in the legs. 8. Can compartment syndrome occur in other parts of the body than the leg? Yes, compartment syndrome can occur in other parts of the body than the leg. 9. What are the general signs and symptoms of compartment syndrome? The general signs and symptoms of compartment syndrome are severe pain, numbness, paralysis, paresthesia, intense muscle pain, muscles tightness, etc. 10. What is paresthesia? Paresthesia is a tingling or burning sensation. Chapter 2. 1. What is acute compartment syndrome? Acute compartment syndrome is when the signs and symptoms of compartment syndrome occur in a short period of time. 2. Can acute compartment syndrome heal on its own? No, acute compartment syndrome cannot heal on its own. 3. Is acute compartment syndrome a medical emergency? Yes, acute compartment syndrome is a medical emergency. 4. What is the main cause of acute compartment syndrome? The main cause of acute compartment syndrome is severe injury. 5. Can a bone fracture cause acute compartment syndrome? Yes, a bone fracture can cause acute compartment syndrome. 6. Can taking steroids cause acute compartment syndrome? Yes, taking steroids can cause acute compartment syndrome. 7. Can cast cause acute compartment syndrome? Yes, cast can cause acute compartment syndrome. 8. Can tight bandages cause acute compartment syndrome? Yes, tight bandages can cause acute compartment syndrome. 9. Can burns lead to acute compartment syndrome? Yes, burns can lead to acute compartment syndrome. 10. Can a blood clot lead to acute compartment syndrome? Yes, a blood clot can lead to acute compartment syndrome. Chapter 3. 1. What is the diagnosis of compartment syndrome? Compartment syndrome can be diagnosed by a physical exam, X-ray, pressure measurement test, MRI, etc. 2. What are the complications of acute compartment syndrome? The complications of acute compartment syndrome include permanent muscle damage, paralysis, muscle contracture, nerve damage, amputation, loss of function, and even death. 3. What is rhabdomyolysis? Rhabdomyolysis is the rapid destruction of muscles. 4. What is the main function of the nerves? The main function of the nerves is to transmit electrical impulses in the body. 5. What is edema? Edema is swelling due to the accumulation of fluids in a tissue. 6. What is sepsis? Sepsis is a life-threatening response to an infection. 7. What is tendinitis? Tendinitis is the inflammation of the tendon. 8. Can compartment syndrome lead to necrosis? Yes, compartment syndrome can lead to necrosis. 9. What is necrosis? Necrosis is death of a tissue. 10. What is ischemia? Ischemia is an insufficient supply of blood to tissues. Chapter 4. 1. What is chronic compartment syndrome? Chronic compartment syndrome is when the signs and symptoms of compartment syndrome last for a long period of time. 2. Can chronic compartment syndrome heal on its own? Yes, with rest, chronic compartment syndrome can heal on its own. 3. What is the most common cause of chronic compartment syndrome? The most common cause of chronic compartment syndrome is intense exercise. 4. Is chronic compartment syndrome a medical emergency? No, chronic compartment syndrome is not a medical emergency. 5. How is acute compartment syndrome treated? Acute compartment syndrome can be treated by fasciotomy. 6. What is fasciotomy? Fasciotomy is a surgical procedure that involves cutting the fascia in order to relieve pressure of the body in an area. 7. What is fascia? Fascia is a connective tissue. 8. Is fascia a flexible tissue? No, fascia is not a flexible tissue. 9. How is chronic compartment syndrome treated? Chronic compartment syndrome can be treated by rest, physical therapy, orthotics, non-steroidal anti-inflammatory medications, etc. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding compartment syndrome.